machine in our building. We've had it for a while now, and we can proudly say that it has saved over 3 lives. So I am extremely happy and honored. I get the pleasure of calling him my bonus son. You all call him the county executive, so I'll introduce him that way. Please welcome our Milwaukee County Executive, David Crowley.
Thank you. Thank you. So thank you so much, Ms. D. Truly appreciate not only what you do, but what your staff does here at the King Center. And I would be remiss if I didn't remind people that today is primary election day, so please make sure you get out and vote. But I'm really excited to be here at the King Center Community Center. This is a place that has been an incredible partner in our fights against the opioid crisis. The team at the King Center have demonstrated their deep commitment to this work by offering harm reduction supplies to our residents, providing vital information and resources to the community, and most importantly, saving lives by preventing overdoses. And we've seen this through the incredible actions of the King Center Community Center staff. And so it's only fitting that we are here to unveil our new Overdose Dashboard, which is a critical next step in our mission to end overdoses right here within Milwaukee County. As many of you heard me say before, my vision for Milwaukee County is that we can become the healthiest county by achieving racial equity. But in order to achieve this vision, we have to rely on 2 key pillars. And that is not only strong partnership, but it's also about transparent data. Addressing a challenge that impacts our entire community requires support and engagement of everyone in our entire community. We all have a role to play. And that's why the Overdose Dashboard is the product of collaboration between the Milwaukee County Office of Emergency Management, the Milwaukee County Medical Examiner, the Medical College of Wisconsin's Comprehensive Injury Center, and the OD-FAST, the Overdose Public Health and Safety Team. Now, OD-FAST is a multidisciplinary team of which Milwaukee County EMS is an active participant comprised of key public health officials, public safety, and other partners to review data and conduct case reviews of fatal overdoses. Now, the Overdose Dashboard is more than just a tool. This is a testament to the power of both collaboration and data-driven decision-making. The Milwaukee County Office of Emergency Management has long been at the forefront of data collection, creating online dashboards to track everything from COVID-19 cases to cardiac arrests. Now, that's because the Milwaukee County EMS system recognizes the value of continuous quality improvement and data-driven decision-making. And now with the addition of the Overdose Dashboard, we are continuing our commitment to data transparency as well as innovation. But collecting this information is only one piece of the puzzle. Sharing metrics and analytics is equally crucial. By making the data publicly available, it allows residents of Milwaukee County, public health organizations, researchers, local hospitals, and other community stakeholders to ensure that their programs and services are properly informed, effective, accessible, and equitable. Now, we've seen the impact that good data can have on driving impactful change in our community. And take our harm reduction vending machines, for example. These have been successful and heavily utilized, and they provide some life-saving tools for many folks in our community. And so utilizing overdose data, we strategically place these machines in particular locations that will be most accessible and utilized by high-risk individuals throughout Milwaukee County. And while my colleagues will provide you with all the in-depth walkthrough of this dashboard, we know that the early data is already showing some promising trends. While 2024 overdose data is being finalized, we are on track to have a major decline in opioid overdose deaths compared to the previous year in 2023. And so to be transparent, the data alone doesn't tell us if this decline is due to fewer overdoses or greater access to harm reduction supplies such as naloxone in our community. But what it does tell us is that fewer people in our community are dying of overdose deaths in Milwaukee County. And that means that there are more opportunities for us to give treatment, to help people be on that path of recovery and stay on that path, because it is a lifelong journey. And every life that we save by giving them access to harm reduction supplies, the resources, educating them, or giving them the treatment and the recovery programs, this is all something for us to hang our hat on. This is victory not only for us, but victory for those who are on that path to recovery. And so I'm grateful for the Office of Emergency Management, the Medical Examiner's Office for prioritizing this life-saving work, and I'm appreciative of our continued partnership with the Medical College of Wisconsin. And now I'm going to pass the microphone to our true subject matter experts, Dr. Ben Weston, Dan Pojar from the Milwaukee County EMS Director, the Medical Examiner, Dr. Tlomak, and Dr. Connie Kostalik, I hope I said that right, from the Medical College of Wisconsin. I know I'm talking about medical issues. I do not play a doctor on TV, so we're going to allow the real doctors to come and really give an explanation. But today, it is really my hope that this serves as a reminder of what is really possible when we work together as a community and we lead with the facts and we remain committed to saving lives. And so I want to say thank you again for being here. Now I would like to invite the Milwaukee County's Chief Medical Advisor, Dr. Ben Weston, to the podium. Dr. Weston? Thank you.
All right, thank you, Mr. County Executive. Good morning. Thank you as well to Ms. D and the MLK Center for hosting us today. It's an honor to be here alongside our partners from the Milwaukee County Office of Emergency Management, the Milwaukee County Medical Examiner's Office, and the Medical College of Wisconsin, and many of our community leaders who are dedicated to tackling the opioid crisis. Now, together we are taking a step forward in making data-driven decisions that will save lives. And today we're introducing the Milwaukee County Overdose Dashboard, a critical tool in our ongoing efforts to combat the opioid epidemic. This dashboard provides real-time data that helps us understand trends, guide response efforts, and allocate resources where they are needed most. Now, while the final numbers for 2024 are still being processed, early trends indicate a significant decline in opioid overdose deaths compared to 2023. And this builds upon our initial decrease in opioid overdose deaths back in 2023. At that time, the first in 6 years, and speaks to the progress we are making together. Now, this progress is resultant from so much work, so many individuals, many who are here today, and so many hours dedicated to this cause. Expanding access to naloxone and other harm reduction resources, wider access to buprenorphine and other medication-assisted treatment, peer and community support networks, expanded housing and transportation access, and other ongoing intervention efforts. Now, what we know for certain, though, is that fewer people in Milwaukee County are dying from opioid overdoses. And that means more lives saved. It means more second chances and more opportunities for folks to access the support they need for recovery. So while the overall trends are encouraging, we continue to see far too many overdoses still in Milwaukee County. We have more work to do. And that work can be informed and focused through a public-facing, transparent dashboard. Data sharing in a comprehensive and understandable way is more important now than ever. We see on this dashboard, for example, that while most age groups have seen a decline in opioid overdoses, there's been a substantial rise in overdoses among those aged 55 to 79, actually rising 15% between 2022 and 2023. Now, you use our dashboard and you dig into that age group a bit more, and you find this is actually specific to men. In fact, that age group among men saw a 22% increase in overdoses during that time period. You dig even further, use the filters in our dashboard, and you find this is most impactful among our black population, with older black men specifically seeing a 26% increase in fatal overdoses between 2022 and 2023, while other populations are declining. And this work, digging into the dashboard, using it in this way, is how community-based interventions can be developed. Rather than focusing on the entirety of Milwaukee County, nearly 1 million people, community-based organizations, Milwaukee County, and you as individuals can focus your efforts, your communications, your interventions on a group that is most affected, a group that is most in need, allowing your work to have the greatest impact possible. And by the way, that is what equity is. It's not a bad word, but it's a way to target our resources, our programs, our interventions most effectively, and provide support where it is needed most. Now, as you can see, the opioid dashboard we're unveiling today isn't just about numbers, it's about action. By tracking suspected overdoses, identifying high-risk areas, this tool allows us to respond faster and more effectively. It strengthens our ability to prevent overdoses, direct interventions, and ensure that resources are allocated where they can have the greatest impact. And it doubles down on our commitment as a county to advancing health in a data-informed, equity-focused, evidence-based, transparent manner. But we still have a long way to go. But we are making progress. Every overdose prevented is a chance at recovery. Every life saved is a reminder of why this work matters. And with the commitment of our partners and our community, we will continue to move forward. So thank you for your time. I will now turn it over to Dan Pojar, EMS Division Director for the Milwaukee County Office of Emergency Management. Thank you.
Good morning. As Dr. Weston mentioned, I'm Dan Pojar. I'm the EMS Division Director in the Office of Emergency Management. You're hearing a recurring theme today, our commitment to data transparency. This started back really in the COVID days when we started to see the outbreak of the infection spread throughout the county. We wanted to understand where and who was being impacted and how we could respond. And then we started to really focus a lot of EMS initiated efforts to that as well, looking at the time-sensitive emergencies such as cardiac arrest. That's why we've created those other data products. So today, that's why we're unveiling the Overdose Dashboard that's been newly created. This would not be possible without the partnerships that we have with other county offices and external partners such as the Medical College of Wisconsin, the Comprehensive Injury Center, and certainly the Medical Examiner's Office. Also, we're really well positioned to comprehensively examine and study the entire county given our role as EMS system oversight. We provide the administrative oversight for the 14 fire departments operating within Milwaukee County. So we have access to all their data, we analyze it, we provide the quality assurance, the education and training, and then a larger expanding group of our team is the data analytics portion as well. So I will give just a real brief tour of the dashboard here on the first tab here. So Emily, scroll down for just a second here. Oh, sorry, up. So you can click on the tabs across the top here, and that will allow you to see the different pages. So we focus on the non-fatal first, and then we move into the fatal, and we talk about some of the details associated with each one. You can also select what year, what municipality, what fire department was engaged, and then there's also patient demographics that you can filter down as well. And these filters apply to all the pages, so if you forget what page you were on, select and filter, just hit that clear all filters at the top, and that'll clear it out for you, and then you can readjust it. But as we scroll down here, we'll see overdose trends. These are the non-fatal overdoses. We see that we flatten the curve and we're starting to go down, so that's a good, encouraging sign early on. We can also see race, ethnicity, and the gender is affected as well. All of them seem to be starting to trend down. Good news. These are the fire departments that have been engaged, and specifically the municipalities. The city of Milwaukee, just given the sheer volume, dwarfs the other municipalities, so what we can actually do is unselect the city of Milwaukee there, and then it will kind of allow you to examine some of the other suburban communities. So West Dallas is another high use area, and you can see the other ones as well. Also, if you hover over a data point, it will pull up a line and allow you to see specific numbers associated with each community as well, just like that. More demographic information, mostly male. We can go to the next page. So this page focuses on the naloxone administration, and this has actually been a really interesting page for us to examine. This first graphic here shows naloxone given by EMS, and so we see a really sharp decline from 2023 to 2024. And one of the assumptions that we have early on is that we've flooded the community with so much low barrier access to naloxone through harm reduction vending machines, public health, pharmaceutical companies providing it over the counter. So EMS is not having to give it as often because the community has it at hand. We're also seeing the same trend with law enforcement administration as well. Another role that the Office of Emergency Management provides oversight for is naloxone training for all law enforcement agencies. So there's 36 or 37 different law enforcement partners that we provide the training and the oversight of their administration of naloxone as well. And they also have a declining trend. So that was a really big data point for us to see putting this dashboard together. there's some seasonality associated with naloxone administration. This moves into, this is the rate by 400,000. This moves into our fatal data, so you can see a sharp decline of fatal overdoses from 2023 to 2024. There's still a handful of cases remaining in the medical examiner's office, so they're still completing that, but as we get that data updated, we'll continue to update this dashboard as well. More demographic information as well, down at the bottom. Also municipalities engaged, similar setup to the non-fatal overdose page as well. And then more focused on demographics. And then for the fatal detail page, this first graphic here shows a cumulative count of all substances involved in overdose fatalities. And so we've seen an increase in cocaine, for example, also some methamphetamine. As we scroll down, this graphic is specific to a decedent that had one or more combinations in their system, or actually two or more. So multi-drug use or things that were already mixed together may have been known or unknown to the decedent, but those are all categorized here. The top five, there's a whole bunch of different variations and combinations that we came across, but we figured we'd pick the top five just to start, and we'll always reassess if we see a change in those trends. And then also seasonality. There's not really a time or day per se that's more active than others. And then of course we always have data notes at the end to talk about some of our methods and definitions of the data elements. So that's a very quick overview. There's lots of stuff. It's interactive. You can click on things and it'll filter down as needed. And I'll answer questions at the end, but now I'll turn it over to Dr. Twomak, a medical examiner.
Good morning. Thank you for inviting me. I'm Dr. Twomak, the Chief Medical Examiner at the Milwaukee County Medical Examiner's Office. Medical Examiner's Office investigates a sudden, unexpected, unexplained, and violent deaths, including deaths due to drug overdose. The cause and manner of death is determined based on investigation, autopsy findings, and ancillary test results such as a toxicology test. Utilizing medical examiner data of fatal overdoses can be a crucial resource for public health, research, prevention, and policy-related initiatives. Medical examiner data can help identify trends in overdose deaths, including shifts in the drugs involved, demographics of those affected, and geographic locations with higher mortality rates. Data can be analyzed to identify common characteristics among individuals who die of a fatal overdose, such as age, gender, race, ethnicity, socioeconomic status, and coexisting health conditions. In addition, medical examiners' data can help identify correlations with social determinants of health, such as housing instability, unemployment, or prior criminal justice involvement. By monitoring trends in overdose deaths, public health officials can respond more effectively to sudden increases in overdose fatalities, potentially linked to batch. Milwaukee County Medical Examiner's Office is the only medical examiner's office in Wisconsin that is accredited by the National Association of Medical Examiners and has on-site a toxicology laboratory. The laboratory is accredited by the International Standard Organization, ISO. By analyzing data from medical examiners, we can gain a deeper understanding of opioid-related deaths, the substances involved, and the factors contributing to overdose fatalities. Historically speaking, fatal overdose data consistently shows a significant increase in opioid-related deaths over the past few decades, especially since the late 1990s. The surge began with prescription opioids and later expanded to include heroin and synthetic opioids like fentanyl. I have been working at the Milwaukee County Medical Examiner's Office since 2006. When I joined the office in 2006, we've seen deaths related to drug fatalities that were caused mostly by prescription opioids, morphine, hydrocodone, and oxycodone. We've seen some fentanyl-related deaths, but those were deaths related to prescription fentanyl. People either consumed it or used fentanyl patches. In 2007 and 2008, we've seen some deaths with heroin and fentanyl. Heroin concentration, we cannot detect heroin in post-mortem blood. However, if someone has morphine and 6-monoacetylmorphine, we know that these people consumed heroin. In those cases, in 2007 and 2008, there was low concentration of morphine, and we've seen higher concentration of fentanyl. Later, the drug-related deaths were mostly due to heroin and cocaine. In 2013, we started seeing more deaths related to heroin, fentanyl, and fentanyl analogs. Deaths due to carfentanil, acetylfentanyl, and fluorofentanyl. Those deaths peaked during a COVID pandemic. Currently in Milwaukee County, we see deaths due to mixed drug overdoses. Very seldom the death is caused by one drug overdose. Most commonly, we see fentanyl, heroin, cocaine, methamphetamine, xylazine, or benzodiazepines. The combination of opioids with stimulants creates complex, high-risk overdose situations that are harder to reverse with naloxone. There's a lot of deaths that could be unintentional. Many individuals who overdose on fentanyl are unaware that they are consuming it, especially when it's mixed with other drugs like heroin. Fatal overdoses data highlights the unintended nature of many fentanyl-related fatalities. I would like to emphasize that fatal overdoses data showed that anyone in any age is affected. People of different race and ethnicity are affected, and many individuals who die from opioid overdose struggle with co-occurring mental health disorders such as depression, anxiety, and trauma-related disorders. Sharing medical examiner data with public is extremely important. It can raise awareness about the overdose crisis, debunk stigmas associated with addiction, and promote support for harm reduction and recovery services. Thank you.
Good morning. I couldn't be more pleased to be here today to be part of the launch of the new Overdose Dashboard for Milwaukee County in partnership with the county executive, with the Office of Emergency Management, with the Medical Examiner's Office. This is an incredible new and enhanced tool for understanding the trends that we're seeing in overdoses, both fatal and non-fatal, across the county. I'm Connie Kostelak. I'm an assistant professor at the Medical College of Wisconsin, and I am part of the Institute for Health and Equity, as well as I lead the Division of Data Analytics and Informatics for the Comprehensive Injury Center. I'm also part of a team of various partners, both inside of the medical college and outside of the medical college, that are working together on various substance use and overdose prevention issues. And this is really part of working together across both county agencies, local community organizations, and a whole variety of partners on addressing what has been a real crisis in the county and across the country. Our focus is really on using data and research and evaluation as a tool to understand and work together to find collaborative ways to address the opioid crisis. And that focus is really on how do we have community impact, and having tools like the dashboard that you're seeing today is a critical part of that work. We are researching a whole variety of different programs, but in many respects, the research only goes so far if it doesn't impact what's happening locally within the community. So an example of some of these efforts that was mentioned earlier by County Executive Crowley is the Overdose Public Health and Safety Team, or what we call ODFAST. And ODFAST is really a very broad multidisciplinary team that comes together on a regular basis to review both aggregate data, so data about trends and what we're seeing across demographic groups, across substance use types, across geographic areas, but then also looks at specific situations where individuals have been lost to an overdose to try to understand the risk factors and circumstances that can potentially be changed to help save lives. Initially, ODFAST was actually funded through a partnership with the Medical Examiner's Office. Now it's a partnership through Behavioral Health Services with the Department of Health and Human Services, funded through a federal grant by the Bureau of Justice Assistance. But ultimately, this is a partnership between multiple county agencies, so certainly OEM and the ME's office are a critical part, as well as the Behavioral Health Services. But then it's harm reduction agencies, it's treatment organizations, it's criminal justice agencies, it's healthcare organizations, a whole wide variety coming together to utilize data like you're seeing on the dashboard to help guide decisions, to help make recommendations, and look for areas for potential improvement and change in how things are operating. So I think it's really important just to recognize that data is a tool, but it's also a really critical tool to understand what's working within the county, to understand the trends that we're seeing, where we should be focusing our efforts. And it very directly ties into some of the work of a team like ODFAST. So understanding, for example, actually what was mentioned earlier, where we're seeing changes in demographic groups, increases in overdoses among individuals who may be unhoused, looking at individuals who are recently releasing from incarceration. Those are all areas that we have been tracking and exploring over the last number of months to make recommendations for change. And a tool like the dashboard is really central to how that work happens. So we've been collaborating very directly with the Office of Emergency Management and the ME's office on the development and launch of the new dashboard. We had developed an initial dashboard that's been out for the last couple of years. What's really exciting about this is it is taking it to a whole new level, and it's adding features, it's adding functionality, and most importantly, it's going to be long-term sustainability. A tool like this often starts and then doesn't have a way to continue over time. And what's really exciting about this is having the county take this and launch this new tool is really going to ensure that we have this resource into the future as well. So I can't emphasize enough from our standpoint that having data accessible to the community, to community partners, is so central to all of the work that's happening and to the efforts to help to keep people safe within the community. So we really do appreciate the ongoing partnership. We appreciate being able to continue to work with all of the agencies at the county and beyond, and trying to look at how we can have innovative ways to work together to address the opioid crisis in Milwaukee County. You heard the great news that we've got decreasing numbers. We're still not where we want to be by any stretch, so continuing to have these data resources and these collaborative efforts will help to keep moving things in the right direction. So thank you for the opportunity to be here today, and I'll turn it back to the county executive.
Thank you. Well, you've heard from our incredible partners at the Office of Emergency Management, at the Medical Examiner's Office, as well as the Medical College of Wisconsin. We care about data, and it's really important for us as a county, not only to make sure that this data, but all the data that we have access to is publicly transparent, because we want to make sure that the community, one of our greatest partners, understand how they can be involved in helping to reduce the opioid crisis that we have been seeing right here in Milwaukee County and, quite frankly, across this state. So thank you for being here, and we'll open it up to any questions you all may have. I'll start here.
So this is obviously an incredible tool. You were able to identify some of the higher risk areas, and you mentioned naloxone
Naloxone.
being flooded into the community. With identifying those high-risk areas, what are you guys going to, what resources are being provided for them?
You want to talk about that a little bit?
Sure. Yeah, so there's a ton of resources that are going out into the community right now. One of the things that Dan talked about in particular is naloxone. And so we put naloxone out there in all sorts of ways that are pretty unique to Milwaukee County. So the harm reduction vending machines would be a great example. That's focused on this sort of data, looking at where are the hot spots in the community, where is a vending machine going to have the most impact to get naloxone out, to get fentanyl test strips out, xylazine test strips out now, medication storage, medication disposal. That'd be one example. Another example would be just getting naloxone out in unique ways. And so whether it's our fire departments, in our sheriff's vehicles and police vehicles, they have naloxone. They give it to folks, no questions asked. It's pretty unusual to be able to walk up to a police officer and say, you want an overdose reversal agent, and they say, here you go. I don't need your name. I don't need any information about you. Here you go. And then maybe one other example I'll point to where Milwaukee County was the first in Wisconsin, one of the first in the country, was getting buprenorphine. This is medication-assisted treatment to more than triple the likelihood of somebody recovering rather than stopping cold turkey, getting that out to people where they are through our EMS system. And so rather than having to go to some specialized clinic, schedule an appointment, take a bus across town, you can have, whether it's under a bridge, on a street corner, or in your living room, EMS can come to you and start you on this medication. So it's really breaking down barriers to help folks achieve recovery.
Okay, and then just so I understand, naloxone, because we were talking about cocaine, fentanyl, meth, and even prescription drugs, what, does that help with all of those, naloxone?
It's a great question. So naloxone only reverses opioids. So there's a lot of different opioids out there, okay? So there's like oxycodone that gets prescribed. There's fentanyl that we hear about all the time. There's heroin that's kind of gone away, although the trends are showing. It's one of the interesting things about the dashboard. It's kind of coming back. And so those all are reversed with naloxone. The problem is, like Dan talked about and Dr. Tlomak talked about, it's not too often we're seeing fentanyl and heroin and oxycodone by itself anymore. It's combined with xylazine. It's combined with cocaine. It's combined with methamphetamine. And so the naloxone may help part of that, but it doesn't help the other part. And so our EMS folks are great. They can help. They can breathe for a patient, things like that. But a bystander a lot of times can't. And so the naloxone makes a huge difference. But the problem is we're seeing all these other drugs in combination as well.
Are we doing anything to get more of the drugs off the streets as well?
Yeah, absolutely. I mean, there's different approaches to this. I think two of the main approaches we're taking as a county, one is upstream. It's all the things you don't necessarily think about as related to substance use disorder, but some of the things the county executive is really passionate about: housing, transportation, healthcare access. It doesn't seem like those are related to substance use, but not just in the next week, but 10, 20, 30 years from now, that's really going to change what Milwaukee County looks like, especially around substance use, but so many other areas too. And then downstream, all those things I was talking about: naloxone, harm reduction. And so that's helping folks who have substance use disorder to go into recovery.
We have a question back here.
Yeah, hi, Natalie Albert with the Milwaukee Journal Sentinel. Dr. Tlomak mentioned the fact that there's a lot of these overdoses that have to do with mental health conditions. So I'm wondering if someone could speak to not harm reduction efforts, but upstream efforts to prevent the addiction from starting in the first place, to get people treatment and access to mental health facilities, if that is something that this data can also inform.
I'm not sure how it can necessarily inform related to mental health, because that would be after the fact. But I will tell you that Milwaukee County has been doing everything that we can to get in front of the mental health crisis that we have been seeing plaguing this community, which started off really during the COVID-19 pandemic and really has continued to persist. And so that's one of the reasons why we were adamant on making sure to build the emergency mental health center, right, which is basically around the corner from here, right, in a community where 70% of the individuals that we were seeing in the Wauwatosa area live in this particular zip code or around. But this goes a part of the conversation about how we need to break the stigma, how we need to have conversations with community members, right? Growing up in the black community, for me, we call it a nervous breakdown because we weren't actually tackling the issues of mental health. We can no longer allow that to happen. We have to have some tough conversations with our family members and making sure that we provide access to the services that they need, whether that's through our emergency mental health center or if that's through any community-based mental health services that we may provide or that's located in the community. I'm gonna go all the way back there and then come to you, Mabel.
Hi, my name is Andrew Lane. This is beautiful, but besides this, how y'all guys got this out to the community, besides the press conference, how else will I be able to give it to, for when you can see this on Facebook? How else would I be able to get this to them? And also, a lot of stuff you went up there and said, it went over my head. And I work with the community. And the barrier is the language barrier. And sometimes with that language barrier, you said something, I would agree with you in everything you said. And at the same time, nothing you said. So how do we change the language so that some of the stuff that you're talking about is understandable for the community that can't understand, like the 6th grade and 7th grade reading level, or somebody with a 9th grade reading level? Because what you said is beautiful, but if I don't understand what you're talking about, it does nothing. So how else is this getting out to the community, and how can we get a better language so that so I can get into it and I don't feel like I got to dilute it?
Well, the one thing I would tell you is that it is not just us. We have a lot of external partners, and actually we have given out grants to organizations that have been doing this work already on the ground around treatment, around prevention, around intervention. So it's not just us having this conversation. But we want folks to understand that's one of the reasons why we have 18 different vending machines around. And when we're talking about mental health, or whether we're talking about the opioid crisis, there is a stigma. And so it's really about continuing to have that conversation, letting individuals who are in crisis know that they are loved and what access to services they actually have opportunities to go get. And so I would tell you that while this is great, and we understand that this is one medium, but we still have to utilize all of our social media accounts, right? TikTok, Facebook, X. And actually we have a group of individuals with the Department of Health and Human Services that literally goes door to door with kits to tell people about what information is out there and how they can receive help. Whether they are in this situation or not, they may know someone. And so it's really about how do we continue to utilize those types of services, those types of teams to go door to door and literally bring the information to their front door. I see one back there and then I'll come here.
I wanted to say,
Sorry.
definitely based on this question, one of the most powerful things that I've seen the county do, because I'm a blessing from that, is not only are they putting these machines in the inner city, in these different areas, they're starting to move. I'm getting ready to have one of the outlet things for Father's Resources. So child support is gonna move here. So mental health, we have mental health opportunities here. So with the county now moving those, the programs are not just at the courthouse. They're not just out at the hospitals. They're moving them into the centers, into the community centers, into these partner organizations. So I think when the county started doing that, it became 100% changing of those numbers that he talked about dropping, because I can attest to 3 of them happening here in this building. So I think that that's a big play for our community, that the programs are no longer at the courthouse, they're no longer at the hospitals, they're right here where the people come. And it's broken down in a language that those people can understand.
All right, we'll go Monty and then we'll go right back to you.
I have a two-part question. Number one, when they were going over the guidelines, it was still higher among Afro-American males. And my concern is self-medication and resources for medical help and attention for Afro-American males, not only Afro-American males, but men of color. There's a lot of resources for non-custodial parents, but when you think about the average Afro-American male, he has no access to them resources because he doesn't have custody of a child, or he just does, they don't have resources for men.
Well, I would say that they can always, particularly if they are in contact with our child support services, we have those levels of resources. When you think about individuals that, or organizations that we contract with, in this building, we have an organization specifically for fathers called Fathers Making Progress, right? And it's really about, again, how do we step outside our comfort zone and really start to build those relationships with organizations that are already on the ground. And so what we need help with is having these conversations in the community where we know that the stigma is still prevalent because people are just afraid to get the access to the health care that they need.
And the other part was accessing treatment, drug treatment, where individuals are told, you have to come back, we don't have room. And it's that moment where they reach rock bottom and they're ready to change things, but they can't get access to it.
Well, what I will tell you, and I will tell you that the problem is that we don't have enough, right? And so trying to bring those on board is something that we are for. We have been investing in programs and services all throughout Milwaukee County through our Better Ways to Cope campaign. Because you're right, these are coping mechanisms that many individuals are utilizing to kind of get away of their current situation. But as Dr. Weston was alluding to, this is really about not only how we help you kick that habit and kick that drug addiction, but how do we put all these other services around you, right? If a person is unhoused, how do we give them the housing services? How do we give them the mental health services, the job skills services? We need to wrap around all the other services. Just because we're helping you on one end doesn't mean we're helping you throughout the entire continuum. And that's where we want to step up as a county.
Thank you. Two more questions. And so how does it feel to have, excuse me, how does it feel to have that tangible data that shows that one, you know, we have a decrease in the usage, but also the fact that you have African American males who are also seeing this incident and dealing with this. And so how does it feel, one, to see this, but also how would you like to address it now that we actually have that physical data in place?
Well, I'll let the doctors speak if they want, but I would say that this allows us to actually deploy services and gives an opportunity to actually figure out what we need to do in real time, right? I think right now we didn't have the data to say, okay, these are the communities that are being affected, the zip codes that we need to go to, but now this gives us an opportunity, and not just as government, because now there are community members, there are organizations that are already on the ground who can now utilize this dashboard to figure out how they fit in solving the problem as it relates to the opioid crisis. I'm not sure if you want to add anything.
Sure, yeah, I would just say that expanding on what the county executive said, this is the information to guide the action, right? And it guides action of DHHS, which the county executive talked a lot about. It guides action of EMS, helping Dan and his mobile integrated health teams, these are community paramedics, know where to go and where to start, right? It's easy to look at one trend line and say, hey, opioid use is going down. We're doing a good job, right? But then you start parsing it out, I think like we're seeing right here actually, and you see, yeah, it's going down in some communities, but it's actually going up in other communities. And so you take OD Fast, for example, I don't even know how many community organizations, 50 community organizations, maybe more, that OD Fast partners with and meets with on a regular basis. And they can not just talk about it, they can actually pull this up and say, hey, where is your community organization based? Who are you knocking on doors with? What churches, what grocery stores, what community organizations are you going to meeting with? Because maybe you want to change that a little bit based on what this data shows. Maybe instead of this church, you might actually do better off hitting up this church because you're going to have a much greater impact if you go there. And so that's the idea of this data. Is it's easy to look at it and get lost in the numbers, but it's really about the impact and the action that you can have based off it. And maybe to add one thing about the kind of understanding, the way that Dan and his team, Mari, Chris, our deputy director, all these folks have done when they do these dashboards is on the surface, it's pretty clear. I think most folks can understand, the trend's going up and the trend's coming down and this and that. But once you start applying the filters, you can take a PhD like Dr. Kostelak and who understands the data much deeper, and they can add filters, they can really dive into it, do statistics, and understand really the trends at a much deeper level. And so we try to design our dashboards so they're for everyone. Someone with an 8th grade education, a 6th grade education could get something out of it. A PhD epidemiologist can get something out of it, and everything in between, depending on how much you dig in and what sort of tools you use.
Final question for Natalie.
Oh, please.
If I could just add a little bit, because we have a program at medical examiner's office that any family of a victim of drug overdose is contacted by a social worker, and this social worker can provide information about resources. We are hoping that those resources will be not only for the family, but for their friends and the community that they live in.
Just one other question. I hadn't heard much about how dispersal of the opioid settlement funds is informing this. How much money has gone into this particular dashboard, and how else does Milwaukee County plan to use opioid settlement funds?
I will have to get the numbers for you for this particular dashboard, but this is the largest settlement that Milwaukee County, in the entire state, quite frankly, that we have received. This is going to be $110 million, if I'm not mistaken, over the course of 18 years. And so we've already deployed many dollars. I know that not too long ago, the Better Ways to Cope campaign identified many organizations. I think it was close to about $9 million that we've already allocated to many of the local organizations doing this work. And I will tell you that we want to continue to build upon the foundation that we have already built up until this point. But we know that rightfully so, these opioid dollars will be helpful. There's much more. There's greater partnership that is needed at both the state and federal level to make sure that we're combating this issue wholeheartedly.
Thank you.
Thank you all.
All right, thank you.